So I'm honored tonight to be here with Chris Bodanowski, Dr. Chris Bodanowski, who is the inventor of the patented ingredient that makes Ultra Cream what it is, that makes it not like anything else on the planet. So thank you for talking with us, Dr. Bodanowski. We're here in Southern California, and it was quite a journey, 2.5 hours for us to be Dr. Bodanowski traveling to be here to talk with us about this cream. Now, this cream came out of not a frivolous project. I know that there was some study about how to treat some of the complication of diabetes. Can you just talk with us some about what was the idea that prompted the development of the main ingredient in Ultra Cream?
Yes, so we started off by studying the diabetic skin as a model for accelerated aging. Right. You know that in the human body, the people with diabetes have an accelerated senescence of the skin, and it's a perfect model to study the wound healing, because those people get wounds much more easy, and it's more difficult to heal them. Mm-hmm. And so me coming from a perspective, from a background of studying wound healing and skin vascularization, I was compelled to develop a product which will help skin of diabetic people, which will translate into an anti-aging product in general.
Mm-hmm. Talk to us more about your background. How were you educated, and how did you come to be studying this process in the beginning? What's your story?
Well, the story was once upon a time. I was studying molecular cancer pharmacology. Okay. My PhD is in molecular and cellular pharmacology of cancer, and I spent 6 years in University of Paris studying the processes which are related to development of cancer, tumorigenesis, and how to control those processes. This brought me for a postdoctoral training to Harvard Medical School, where I continued this cancer research, specialized most in skin cancer treatment and finding the new treatments for skin cancer. And from there, when I moved to California, I worked at Lawrence Berkeley National Lab for some time, studying gene expression in cancer cells, in normal cells, in skin cells, and from there was only one small step to really get involved in the wound healing, in the skin regeneration processes, which basically employ the same mechanisms than cancer actually, except that it's for a good purpose as compared with cancer, where the processes which are suppressed come out uncontrolled. In the wound healing, in the skin regeneration processes, those are controlled processes that the body controls better if you can put it on the right direction. And so I was fascinated by this apparent parallel between wound healing and cancer, and I wanted to understand what are the differences which make them yet so similar but yet so different, and so different outcomes. We found out that there's a big need for compounds which will accelerate wound healing and which would accelerate the skin regeneration, either with or even without wounds. Like in the diabetic patients, people have wounds, but even without wounds, their skin is deteriorating much faster than in normal people.
It's easy to tear.
It's easy to tear. It's easy to get some micro cracks which will develop in hard to heal ulcers, and we were looking for a compound which can first of all prevent this from happening, because prevention is very important. It's the much easier to prevent than to treat once things happen. And yet, when the things really happen, how we can stop the degeneration process, how we can stimulate the wound closure and healing. And we found out that there's a process called angiogenesis, which is a growth of blood vessels, which is very important for the proper healing of the wounds. And diabetic people have a very poor cutaneous circulation very often. And this is a factor which plays a big role in the difficulty of their wounds to heal. So we looked for compounds which can support the growth of blood vessels, which can support the stability of the blood vessels, because blood vessels may be leaking, can be not strong enough, can break, can have hemorrhages. You can basically, and this is basically also what happens in cancer. The blood vessels are really leaky, and this is one of the factors that I worked on. How to make the blood vessels more, in French you say étanche, less prone to leaking. And this can, we realize that this can have a very, very important implication for healing of wounds and for the skin regeneration in general. When we age, the density of blood vessels decreases in a human skin. And with this decrease, you also get a decrease of oxygen being transported to the skin. You cannot evacuate the metabolic wastes. The cells become senescent, and all those are factors which play a big role in skin aging and in the inability of healing of wounds in a diabetic skin, and not only in diabetic skin. So we developed this product. We screened a lot of natural compounds because it was important for us that it's a natural compound. We had a kind of what is called HTP platform, high throughput screening platform, which allowed us to isolate a couple of lead candidates, which we then tested on several different animal models, enzymatic models. We grafted human skin on mice, and we wounded the skin, and we looked how the skin heals the wound in the presence of our compounds. So
is that the platform you're referring to?
Yes. Okay. Yes. Well, actually, the platform is multi-level. First, you have a high throughput screening platform, which is in vitro platform in a kind of 96 or in the 96 well plates. Then you select a couple of compounds which are the best giving the most hope that
so you have tissue growing on the plate.
Well, you have cells growing on the plate.
Okay, yes. Beautiful. So
yes.
Okay.
And then you look at the processes which happen in those cells. You can measure those processes by measuring expression of genes. There's a technique called PCR, polymerase chain reaction, which is used for that. You can use enzymatic assays, ELISA assays. You can use immunofluorescence. You can use a lot of techniques to zero on the compounds which are the most promising ones. So from there, you go to a next level, which is an animal study, and we used either genetically diabetic mice, which are genetically prone to diabetes. They develop diabetes after a certain time, or you can use immunodeficient mice, which don't have their own immune system, so you can graft human explants from the surgery waste material on them, and then you can work on those human skins, but supported by the animal organism. And at the end, you have the patients to whom we gave this compound, and they put it on their skin, and we formulated it, and they put it on around their wounds, and that was the ultimate level of validation. Okay, so after validating the most promising compounds in the cellular model, we transitioned to the animal model, and for that we needed grants from National Institutes of Health. This is a very expensive study. It's a series of studies, and it requires sophisticated animal strains which are genetically diabetic or which are immunodeficient. So after validating the most promising compounds in those animal studies, we formulated this molecule, and we applied it to volunteers under supervision of either the doctors, pediatrics doctors, or family doctors, or doctors who are responsible for patients with diabetes, diabetologists, I guess. And they applied, they gave this product for the patients to apply on their skin and around their wounds. And we measured, we did several types of measurements. We measured the skin oxygenation, because this was the most important thing that we were looking for, whether this cream allows a better oxygenation, better vascularization of the patient's skin. We measured the transepidermal water loss to see if the barrier function of the skin is a little bit improved with this product. We measured skin elasticity and what else? And skin thickness. And all of those parameters turned out to be increased by the application of the product after 15 to 30 days. So the skin was more elastic, the skin was more oxygenated. We used this very sophisticated partial oxygen pressure meter to measure the oxygenation of the skin. The transepidermal water loss was decreased, so we got all the parameters improved that we were looking for. And then, and only then, we decided, okay, this cream may be now put forward to the, to see the world and to be commercialized.
Beautiful. And so that whole process took how much time? From the time that you started testing on the plates, is that when you marked the beginning? Or before that? Before that, you had to think about what to put on the individual plates.
Yes.
How did you come up with a list of things you tested?
Well, we looked mostly for compounds which may have some merit or may have some hope to improve the circulation. And this was not a very kind of straightforward thinking, because when you look for skin products and the skin actives, you don't really think about the circulatory system. You think more about the epidermis, dermis, keratinocytes, fibroblasts, the skin cells. But here we actually took a more kind of holistic, more wholesome approach, and we looked for compounds which may be beneficial for the blood circulation in general. Mm-hmm. And so we looked for medicinal plants which have some track record of benefit for heart, for blood vessels, for bleeding, things like that. Mm-hmm. So one of those compounds turned out to be isolated from a Chinese medicinal plant. Mm-hmm. called Angelica sinensis, mm-hmm. which is considered in Asia to be like an equivalent of ginseng for used more for the female part of the population. Mm-hmm. And I learned that actually this compound and the plant where this compound is prevalent is taken by women who have a prolonged menstruation which cannot be easily naturally stopped. Mm-hmm. They continue bleeding, and so we rationalized that this bleeding may be due to the fact that the blood vessels cannot be sealed, cannot be healed, mm-hmm. and that's why the bleeding continues. Mm-hmm. So we were looking for a compound which is going to make those blood vessels stronger. So I immediately thought this may be a good candidate for our search, and indeed we found out that we did first some studies on a microcirculator in vitro. You can make a kind of three-dimensional network of blood vessels using capillary blood vessels, which you can make, but after a couple of days, those networks, they're outside of the body, they will fall apart. And so we use this experimental system to study those different compounds to find out which compounds can support this network to extend the life of this network, make it more kind of robust. So this is how we isolated our most promising lead candidate. And from there, we did this animal studies, and then we had to formulate this compound because, especially for the skincare, the compound itself can be very good, but if it does not penetrate inside the skin, it's useless. So it also has to be non-irritating, because you can have a very nice compounds which work very, very well in vitro, work very well in animal models, but when the patient puts it on the skin, says, "Oh, it stings," and it is not comfortable, and so it's not going to use it, even if it's going to provide the patient with a benefit. So we had to formulate this compound, encapsulate it in a way that it's not going to be irritating. It's not going to make the skin irritant, and it's not going to make the compound irritant. It's going to provide penetration into the skin. So these were all those factors which we had to take in consideration, beyond the active molecule that we developed.
So I think you partially answered this question, but for example, you can have foxglove that becomes digitalis, or you can have whatever, you can have a chemical that becomes aspirin, you can have natural products, or you can have, what's the chemical that becomes, so you can have yohimbe, but then if you get a very nice isolate of it, it becomes a prescription drug and becomes Yocon, which they took off the market when Viagra was approved. It was actually a very good drug because it was a very, very concentrated isolate of yohimbe. So back to this product, what is it exactly that you did that make that natural product become more medicinal, more concentrated, less irritating? Did you change it biochemically? Did you encapsulate it somehow? What did you do to it to make it more medicinal and less like the natural root?
Right, yes, it's a very good question actually, because, and the answer is we did both.
Okay.
So from first we isolated a sub-fraction of this plant, of this root, and we refined it to the point that there were only very few molecules, and only the molecules that we want there.
Okay.
And we
by a distillate process, or how did you isolate it?
It's a multi-step process, mostly by chromatography,
okay,
by filtration,
okay,
by affinity chromatography.
Yeah.
So
because this is the kind of stuff, this detailed sort of science is the kind of stuff that this is what you do in a day. But when people look at this product, they may not have any idea what you did that took this natural root and turned it from foxglove into lanoxin, so to speak, metaphorically. You took a natural product and you turned it into something much more usable and more effective. So what you're saying is by some multi-step, so through gas chromatography and some filtration systems, you took the different chemicals that were in this natural product, natural root, and you isolated a particular part of it that seemed to be doing most of the work. Is that what you're saying?
Yes. It was a fractionation which was based on biochemical properties
okay.
of the different ingredients in the root,
okay.
and it's called bioactivity-driven isolation.
Okay.
So basically, to start with, it's kind of very difficult to isolate compounds from a botanical natural source because it's so full of molecules. Right? I mean, life is full of molecules. Right? So we needed to design a method which will allow us to be guided by the bioactivity to gradually isolate the less and less amount of the smaller and smaller fraction of those molecules from the root, to the point that if you remove one more, it's not going to work, or it works less.
Yes, so as simple as it needs to be, but no more simple than that.
Right. It's a kind of fine balance.
Yes.
So if it's too much, you are going to tag along some compounds which may not be desirable.
Yes.
If you purify too much, you are going to lose activity, because very often in life, things are happening not because of one molecule.
Yes.
Very often it is combined activity, synergistic activity of several compounds which basically make things happen.
Okay.
So, our pharmacological approach to medicine is basically purify one molecule, make it as pure as possible, make it into a drug, which intellectually speaking, scientifically speaking, is very accurate. But very often you miss some activities which could be much better if you could leave a couple of compounds together. It would be a not so much defined product, but still very, very useful.
Okay.
And so we decided not to go all the way to the pharmacological grade of our preparation, which would allow us to file NDA and get a prescription medication status, because we would lose this, at least partially, this activity, which is contained in a multi-component preparation. So we stopped at the kind of border between multi-component and pharmaceutical grade.
So I'm taking it that you tested both sides of that line to figure out where to stop. Is that correct?
Well, yes. We tested. We of course did many different isolation repeats. It was a kind of trial and error process, and that's why it took such a long time. 6 years, right?
Yeah.
So we finally ended up with this minimum necessary amount of compounds which are going to provide an optimal activity for the blood vessel support and the skin regeneration.
6 years.
6 years.
Yes.
So and it could have been much longer if we didn't get the support from the government, from the NIH. So that was actually quite a big support.
Meaning that you had other people helping you with this testing?
Well, there was a funding from National Institutes of Health, because we also developed a wound healing, a wound dressing, which is a companion to the skincare product. But also, of course, I wouldn't be able to do it by myself. These days scientists, they don't work, solo. They have teams. So I was fortunate enough to have a good team of colleagues and technicians who really put their energy and their heart into this project. So once we had this multi-component botanical isolate, we needed to formulate it in a way that it's not going to be irritant to the skin of the patients, and which will allow the active materials to penetrate into the skin. And that was another challenge. It's actually often underestimated how much effort has to go into formulation of those active materials for the skin. So most of the skincare products are they are called emulsions, oil in water emulsions. So basically you have the lipophilic compounds which are surrounded by the water like film. And we took an alternative approach we actually got a water in oil formulation, which is more difficult to make, which takes more effort and more research to standardize, but which allows you to have a kind of a packaging which is friendly to the skin, because skin, is mostly composed of the bilipid layers, right? So you need a packaging which is going to interact with the stratum corneum, which is this upper layer of the skin, of the epidermis, to allow the compounds to be then kind of introduced into the lower layers of the epidermis and even to the dermis. So this water in oil solution allowed to first the oil to contact the skin, and then kind of dissolve into the oil lipidic membrane, and then allow to introduce the active compounds which are water soluble inside the skin.
So the oil acts as a carrier to allow the aqueous part to then penetrate behind it somehow?
That's very much correct.
So what you're describing now is the formula for what's the other ingredients in the package, is that correct? This formula for water and oil is the thought process that went into the other ingredients.
That's right.
Can you specifically tell me some of the things on the list that accomplish what you just talked about?
Well, there's, as you can see, there's a lot of compounds,
yes.
And there is a story behind each of the compounds. So, for example, dimethicone is a FDA-approved skin soothing compound, right? There is hydrolyzed silk. This is a very interesting compound that we worked separately on. And we found out that the hydrolyzed silk, basically it's a protein, and this protein is very good at stimulating the collagen expression. So we actually, so now we go back to the laboratory studies. One of the studies that we did is to assemble some of those components and put them on the skin and measure the gene expression measure the gene expression in the skin. So basically, by measuring the gene expression, you have a genetic printout of the kind of you learn what is the genetic response of the skin to the formulation that you are applying on it. So this is also something that we did. It was the time that we did it was very unusual to do, because you don't, look at 30,000 genes. That's the amount of genes that we have in our bodies, to formulate a skincare product. But we did just that. We did what is called DNA microarray study, which allows to measure the expression of every single gene in the tissue.
Right.
So in our case, it was skin, and we measured, we quantified the expression of those genes with or without our formulated product.
With the hydrolyzed silk?
With the hydrolyzed silk, yes. And we found out that hydrolyzed silk adds to the benefits of the Angelica sinensis extract. So that's what's only some of those. Shea butter is a very good oil, which basically provides a lipidic kind of environment.
So is that part of the carrier you were talking about?
It's a part of the carrier. It's not just like two compounds that it's not like two Lego blocks that you put together.
Sure.
It's more like a enmeshed entity. It's a kind of integral structure which is formed between the lipophilic compounds, which are more towards the outside, with the more and more becoming hydrophilic when you get inside the formulation. Now, the formulation, you can think about it as about like liposomes a little bit, or like micelles.
Okay.
And there's like a gradient of hydrophobicity from the outside to the inside, and different components occupy different layers in this gradient.
Beautiful. So I notice when I use it, it does have an exceptionally just smooth, pleasant feel to it. Is that what I'm feeling? That sort of lipolic outer layer with the aqueous? What would you attribute just to the fact that it just feels very soothing? Is it the whole recipe, or is that something that?
Yeah, it's like it's like a chef cooking.
Oh, gotcha. So the recipe,
dish, right?
Yes.
It's like,
so how many years do you have in this recipe?
This recipe is 6 years of actual testing.
Just on the one ingredient, right?
On the one ingredient. Well, we did the testing in parallel, several ingredients.
Okay.
So yes, if you add the years of experience, of work on each of the components, it's going to be probably close to maybe half a century.
Yeah.
But
Are you half a century?
half a century.
Are you half a century old?
Well, that's actually I am getting there. Yes.
Okay. Well, I think it's very plain that this is just not some. This is not lotion you pick up at the local dime store. This has a lot of thought, and I'm actually honored that you're allowing us to make it part of our procedure, because I think we have an amazing group of doctors. We're now in 50-something countries. It's about 2,000 of us and growing. Really brilliant physicians in multiple universities. And I've had a lot of people bring stuff to our group that I've said no to for 8 years. But it went from nothing was good enough to us to now I'm actually honored that we're able to offer this as part of our procedure, because I think obviously it has a big piece of the life of a very brilliant man built into it. So I'm very grateful that.
But the honor is reciprocal, because I also feel that this product really fits perfectly into your strategy, because of its double effect on the blood vessels, the strength of the blood vessels, and also on the skin and the regenerative, the healing potential of the skin, which I think is going to be very well matched with your products, which need to be introduced by puncturing the skin gently, and this product is going to allow those punctures to go away in no time. So I think it's a perfect match.
Yeah, when we use our PRP, we have biopsy studies that plate-rich plasma causes neovascularization, and the idea that we have a cream now, whether it's with microneedling or subdermal injections, PRP causes fibrogenesis and neovascularization, and now having a cream that does the same thing at the same time, it's no wonder that we're seeing really what borders on miraculous results. We have other procedures other than just facial procedures that we're doing. For example, we have a procedure where we use PRP to regenerate the appearance and the function of the labia and some of the sexual tissues. And so, anecdotally, some of my patients have told me that even post-waxing the labia and using this has a calming effect and a healing effect. Waxing can be pretty brutal to the skin, or just shaving, the post-shaving down the labia where the tissue is so thin and fragile, using this afterwards. So I'm eager to see, like any new product, you roll out a product, you do lots of testing. Just think about the drugs. You do thousands of tests, millions of dollars, and then you put it in the hands of consumers, and then they reflect back to you because there's thousands of people using it. Right. Stuff you haven't thought about. So it's going to be fun over the next few years to see what happens when we put it in the hands of our providers and literally many thousands of patients.
Yes, I feel like it's my baby that grew up and comes out, and I don't have any control over it anymore. But it's interesting what you said about the shaving, because it comes back to this idea of the female ginseng. And I think that at least in Asia, this plant is being used by the female population predominantly, and maybe because there is some specific benefits related to the gender.
I need to be careful. I've been putting on the scrotum of the penis. I'll just tell you that right out, because to me that's important that stays healthy too. And if you're going to have fewer older cells, why not put it on your penis? So I've been putting it on my scrotum and my penis, and I think it's happier.
The skin, yes. I mean, wherever you have skin, this product belongs to wherever you have skin.
Yeah. Yeah. So one other question. So this plant from which the isolate is made, are we going to run out of that? And where does it grow? I haven't seen it growing. Obviously, it's in China. It's in other places. Are we going to all find this product is wonderful, and then all of a sudden we can't get the plant anymore?
Right. Yeah, it's a good question, because I was referring to female ginseng. It's not like ginseng, which you have to go to the mountains to hunt.
Which I've done before. It's very hard to find.
But it's like truffles in Italy, right? Yes. So this one is actually cultivated. It can come from organic fields, so it can be certified organic, and there is a control, over the supply. So we don't need to worry about that.
Good, glad to hear that. So I'm really honored to talk with you. So I think that's all the questions I have for now. And but I'm going to invite our providers to write in and to our blog and the people who use it to let us know. Hopefully they'll teach us more about your baby, about what it can be used for, and I do think it's going to take a life of its own. I'm very grateful to you for thinking about it.
So yeah, I'm giving it to you now.
Thank you very much.